So for our first panel, it's going to talk about extreme risk protection orders. We're going to have two speakers, Dr. Jeffrey Swanson, who's professor of psychiatry and behavioral sciences at the Duke University School of Medicine and a visiting scholar at the Johns Hopkins Center for Gun Policy and Research. And he's going to be followed by Shannon Frattaroli. Dr. Frattaroli is an associate professor at the Johns Hopkins Bloomberg School of Public Health and is core faculty at the Johns Hopkins Center for Gun Policy and Research. If you want to know a little bit more about them, their bios are in your folders. With that, I'll turn it over to you, Jeff.
Thank you. Good morning, everyone. So I think of gun violence in America as a puzzle, and one of the missing pieces in that puzzle of gun violence prevention has been what to do about people who clearly pose a serious risk of misusing a firearm, of harming someone else or themselves, but they can legally possess guns. They can legally purchase guns. They don't fall into any of the categories that would prohibit them from purchasing or possessing a gun, such as having a felony criminal record or having a history of involuntary commitment. But people around them know that they pose a risk. I mean, this could be your Uncle Floyd, who served his country honorably in the Air Force, but he's just had a really bad year. And now he's drinking heavily. And one night, he takes his own deer rifle and ends his life. And it's a horrible tragedy for everybody, and people knew this. So extreme risk protection orders are designed for situations like that, among others. Uncle Floyd would have passed a background check. Background checks are necessary, they're important, but they wouldn't necessarily deter someone from misusing a gun in a situation like that. Uncle Floyd isn't necessarily, he wouldn't always pose a risk. Maybe he would have gotten over it, would have gotten some help. And so the features of a risk protection order are as follows. They're time limited. They're not forever. They give police officers the clear legal authority to search for and remove firearms from a risky person at a risky time. It's a civil court process. It's not criminalizing. The person, there's legal due process that's built in at the front end. Typically, what would happen is, if you live in a state like this, you can call the police look into it, and they get an order, an ex parte, parties not present order from a judge who removes the guns, and the police officers can then remove the guns. And then within 2 weeks, there's a hearing, and all parties can be heard. And at that point, the state has the burden of proving, by clear and convincing evidence, typically, that this individual continues to pose a risk of harm to others or self, and then the guns can be retained for up to a year. So let's flash back to the year 2013, right after the Sandy Hook shooting, and I'm going to show you a map of all the states that had a law like this. There were two, Connecticut and Indiana. It's kind of interesting, these two states, right? I mean, Connecticut, the Democrats are in charge of the state legislature, and in Indiana, the Republicans have a supermajority. These states differ on a lot of parameters that have to do with possession of guns and the strength of other gun laws and so on. But they were both passed after a concern about a mass shooting. And it was a response of the state legislature to a concern and public outrage over that. Now, let's flash forward to 2019. That's the map. All those dark blue shaded states have some version of an extreme risk protection order law. The first one after Connecticut and Indiana was in California, after the Consortium for Risk-Based Firearms Policy thought about this and developed this idea a little bit further, where family members would be able to go directly to a judge and petition for a removal of guns. And the light shaded ones are states that have proposed this, and this is already out of date. There are other states that are not even on there. So if you think nothing has happened, nothing happens at all in terms of gun violence prevention laws, take a look at this. A lot is happening at the state level. So what do we know from research about whether these work? Well, our research group has conducted studies in both Connecticut and Indiana. And what we found was, notwithstanding the laws were passed out of concerns for mass shootings, as they have been used, most of the time, 2/3 of the time, they're used for a suicide concern across the age span, mostly men. About 1 in 4 or 1 in 5 times there's a homicidal ideation or threat. About the same for alcohol or drug intoxication. Acute mental illness or dementia is a minority of those. So this is not about mental illness diagnosis, although it's going to capture the proportion of people who might have a mental health problem who are posing a risk, at least for a period of time. The average number of guns removed per person, 7 guns per person in Connecticut and 3 in Indiana. So these are people who have a lot of guns typically. The average, and what happens typically if the police go in and they find someone to serve this risk warrant to take the guns away, is they find someone in a crisis, and over half the time they transport that individual to a hospital emergency department for evaluation. And in Connecticut, the proportion of people actually receiving treatment for a mental health problem in the community doubled from 12% to 24% in the year before to the year after the gun removal action. So sometimes it actually provides a portal into treatment and people getting help. So does it actually save lives? Well, it's hard to tell in terms of mass shootings. We didn't have any homicides, but when we followed up these cases and looked at death records, we found a very high rate of suicide, 30 to 40 times higher than the general population rate of suicide. I think that's important politically and legally because it shows that the law is not being applied willy-nilly to everybody. It's being applied to a group of people who actually are at high risk of misusing a firearm. So if finding that person, who's going to do this is a needle in a haystack, this gives you a much smaller needle with more haystack, a much smaller haystack with more needles in it. And so, what we were finally able to do is estimate because, very few of these actually used guns, these suicides, and none of them happened, except for a couple cases within the year when the guns were removed. They all happened after the person became eligible to get their guns back. But they used other methods. And so we were able to calculate, to do this kind of what if. What if the guns had not been removed? How many more people would have died? Because the case fatality rate for using a gun in suicide is incredibly high. And the answer was for every 10 to 20 of these gun removal actions, 1 life was saved by averting a suicide, by moving it to some other method of suicide that is much more survivable. And there's emerging evidence from a number of the new states that have enacted these laws that actually there is, that some mass shootings have been thwarted. People have intended to commit a mass shooting and they have been stopped by this process. So that's the kind of the information that we want to put in the hands of lawmakers about what's in the balance of risk and rights. Is this high or low? 10 gun removal actions to save 1 life. Well, if you care more about the Second Amendment right than anything else, maybe it's unacceptable. But if you're like many people, like me in particular, you have a gun suicide story in your own family, maybe that's an acceptable balance. And this is the policy that works. I'll turn it over to Shannon.
Thank you, Jeff, and good morning, everyone. Thanks so much for being here on an early Monday morning. I want to start off by just picking up on 2 things that Jeff said, because 2 of the things that he said really run counter to the narrative about gun violence and opportunities for prevention in this country. And the first thing is with regard to what extreme risk protection order laws do. These laws are really focused on intervening when people are behaving dangerously, when people are making threats about what they're likely to do. This is a behavior-oriented type of intervention. It's not about mental illness. And the reason for that is because we know from the research that the best predictors of future violence really are those dangerous behaviors. So the way that these extreme risk laws are set up is to be put in effect when people are acting in ways that suggest that they are going to commit violence or are threatening that they are going to commit violence. Again, either against people, against others, or when it comes to suicidal ideation and harm to themselves. So that's the first point that I just want to emphasize from Jeff's overview. The second point goes to those wonderful maps that he showed you. You know, we have an ongoing dialogue in this country that gun policy, gun violence prevention policy, is something that we can't do. It's unattainable. But when you look at what's been going on in the states over the past 6 years, and there's a lot of policy people in the audience, we can all appreciate that 6 years is not a lot of time in the policy world. Over the past 6 years, 15 states and the district have passed extreme risk protective order bills into law. That's incredible. Change is possible here in this country, and this case example proves just that. So I'd just like you to keep that in mind as we talk about the opportunities that exist with regard to extreme risk protection order laws in this country and the recommendations that we have with regard to these laws in particular. So with regard to the opportunities, the first thing that I'd like to just emphasize is the importance of implementation and the real need to focus on implementation of these laws. So these laws have come online in very short order, and there's a lot of different ways that states and localities are working to implement them. We at our center, with the help from the Educational Fund to Stop Gun Violence, have been working with states and localities to identify those places where model implementation efforts are occurring. And there's some great work going on out there. Work like in Maryland, where we have the sheriffs who have really taken the lead to, prior to our law in Maryland going online in October of 2018, making sure that there was solid law enforcement training that was offered to law enforcement statewide. What do we see around the state as a result? We see extreme risk protection order laws being used statewide. We see them being used in a way that's fair and just and consistent across the states. What else do we see? Local jurisdictions like King County, where Seattle is located in Washington State, are doing a tremendous job of bringing together multi-agency teams of law enforcement people to work together to make sure that whether you're in the police department, whether you're in the sheriff's department, whether you're a prosecutor, whether you're a judge, you know what the law is, you know how it works, and extreme risk protection order laws are being issued in a way that's consistent, fair, and in the best interest of community safety. So we've got good models out there with regard to how implementation should work, and we need to really focus on implementation for those states where extreme risk protection order laws exist. And the good news is that we've documented and collected a lot of information with regard to some of these model jurisdictions on a website that's shown here on the slide. So if you Google Johns Hopkins, American Health, ERPO implementation, you'll come to our website and you'll see video interviews with the frontline law enforcement people who are making these laws happen, again, in a fair, consistent way that's making a difference for community safety in the places where they're involved. The second thing that I would mention with regard to opportunities is that while we have 17 states in the district where extreme risk protection order laws are in place, there are 33 laws in this country that don't yet have the benefit of these laws. Now, most of those states have actually introduced bills, and they're working their way through conversations in those places. But this is a real opportunity to bring this life-saving policy intervention to places where it doesn't yet exist, to places where there are lots of Uncle Floyds, like what Jeff mentioned, who could benefit from the type of intervention that extreme risk protection order laws give. And the final thing that I'll just mention with regard to opportunities here is the opportunity for research. We have these laws that are rolling out all across the country in states like California and Massachusetts, and states like Nevada and Hawaii and Florida. You know, this is a policy intervention that diverse states have really taken up, and there's a real opportunity to figure out through research how we can best implement these laws to assure that they have the maximum benefit on the public's health. So given that, what do we have to say with regard to specific recommendations here today? Because we want you to walk away with some very tangible things that can be done in response to the evidence that we have about these laws. So a few things. So first of all, while extreme risk protection order laws are really a state-level intervention, I don't want to leave you with the impression that there's nothing that we at the federal level can do, because there's lots that Congress can do. And perhaps the most important thing that Congress can do at this point in time is to really support the state implementation efforts through federal funding. So federal funding can do a number of things to support good implementation at the state level. Federal funding can support training of law enforcement like what I witnessed happen in my home state of Maryland, so that law enforcement officers, when they are on scene and identify a case that would benefit from a temporary gun removal, know how to approach the court, know how to serve that order, know how to safely remove those guns. Training's essential, and the federal government can play a good role in assuring that that happens around the country. We also want to point out that federal funding can go a long way toward incentivizing the type of multi-agency collaborations that I described happening in places like King County, Washington. Having the benefit of law enforcement teams of frontline law enforcement officers working together with prosecutors and judges to assure that everybody who's involved in the decisions around extreme risk orders and the service of those orders knows the law and is working together well, again, to assure that these laws are being issued in a consistent and fair way that will benefit the community safety. There's also a need to make sure that there is education for allied professionals like clinicians, like school administrators, and community leaders in these laws. As Jeff mentioned, it's not only law enforcement that can initiate these petitions, but in most states, the overwhelming majority of these states, family members and intimate partners can also initiate these petitions. So the importance of people understanding when these laws can be used and the processes that are involved is really key. I want to also mention the importance of assuring that the systems that are in place to support the extreme risk order infrastructure are working is really very important. So extreme risk protection order laws temporarily prohibit the respondent to those orders from purchasing and possessing guns. So in order for that purchase prohibition to work, we need to make sure that our national instant criminal background check system is up and receiving the people who are prohibited temporarily under these orders. So attention to making sure that once those orders are issued, that they get into the NICS system is really important, or else those laws aren't going to be effective in prohibiting those gun purchases from happening. And finally, the last important role that the federal government can have in terms of supporting these extreme risk laws is to make sure that researchers are adequately funded and supported to identify best practices for implementation, to identify how best different jurisdictions can implement and enforce these extreme risk order laws, and to assure that the impacts that are being realized through these laws are being measured and shared with the practitioners involved so that we can inform those implementation efforts going forward. So that's a lot of tasks for the federal government to accomplish, but I have every confidence that Congress is up to that challenge. At the state level, there's a number of things that the states can do as well. For those 17 states in the district that already have extreme risk protection order laws in place, pay attention to implementation. You've got a wonderful tool at your disposal. Let's make sure that you use them well. We here at the Johns Hopkins School of Public Health, Bloomberg School of Public Health, are ready and willing to support implementation efforts. Again, look to our website for guidance with regard to how to implement these laws well. And for those 33 states that don't have extreme risk protection order laws on the books yet, work hard with the stakeholders in your community to get those laws passed, and then work with us to figure out how they can best be implemented. Again, thank you so much for tuning in this morning, and I will now turn it over to Dr. Benjamin to introduce our next panelist.